Hi, my name is Wendy, and I'm a registered dietitian and a certified diabetes care and education specialist. I work in Healthy Traditions Department at Sonoma County Indian Health Project. Thank you for joining our class today to learn about the ADCES 7 self-care behavior goals, which are a framework for diabetes care and education specialists to empower people with diabetes, prediabetes, and cardiometabolic conditions to support informed decision making. Making healthy changes to your lifestyle can improve blood sugar levels naturally, and in some cases require less medication. Here are the 7 self-care behaviors. Today's class will focus on monitoring. So to start out, just a basic explanation of what is type 2 diabetes. Type 2 diabetes happens when everybody who eats food that has carbohydrates in it, it's going to go into your bloodstream and cause glucose, which is sugar in your bloodstream. So insulin is produced by your pancreas, and it acts kind of like a key to let the glucose into your cells to be stored and be used for energy. The body needs sugar, glucose, for energy, but too much glucose can cause damage to the body's organs over time. People with diabetes either do not make enough insulin or there is insulin resistance in their body, which makes it so the cells don't recognize that insulin and it leads to higher sugar in your blood. One main thing to remember is that it is not your fault that you have type 2 diabetes. It's your pancreas's fault. So tracking and organizing data, such as your food intake, your activity, blood pressure, stress levels, and blood sugar, can help you see the story that the data is telling you. There's a lot of easy ways to track data, including just simple paper logs. There's a lot of apps that they have on smartphones now, or software programs that come with your monitoring device. So monitoring includes all of these things listed here. So of course, checking your blood sugar and your blood pressure regularly, keeping track of your activity and your food intake, understanding blood glucose patterns, which we'll talk about in a minute, getting regular foot and eye exams is very important, regular lab work to check your lipids and your kidney health. Awareness of your body symptoms, maybe blurred vision or shortness of breath, kind of logging these, gathering all of this data from multiple sources so that you can make decisions about your care and self-management. So how to use a glucometer. Washing your hands before using your glucometer is going to remove any residue from the skin that can cause inaccurate results, right? It also prevents infection. So you can use an alcohol wipe to clean the surface. Washing hands is always preferred, but just make sure that your hands are fully dry before taking a blood sample. Read the instructions that came with your glucometer so that you know exactly how to use this. And of course, ask your healthcare team if you need help or extra instruction on how to use your device. And again, always put your lancets into a sharps container, which can be provided from the clinic. So this is a funny question when I ask patients, why are you checking your blood sugar? Most of the time they tell me because the doctor said to, and that's a great answer. Um, and the glucometer is a tool that can help you learn how your body handles different foods and activity. So I think it's important to know your goal ranges. So asking your doctor, what is my goal? What is too high, of a blood sugar, so that and knowing the ranges that you'd like to stay in. Understand what is a real low blood sugar. is under 70 usually. Even though we can have symptoms of a low blood sugar, it's often an okay sugar, so knowing from your doctor, what is an okay number, or when do I have to eat some carbohydrates to raise it up? Know what medications you're taking that could lower your blood sugar. Are you taking insulin? Are you taking any other medication that requires you to eat with the medication? So being cautious of the lows because those are dangerous. And an important thing is know what you can do to lower your blood sugar levels naturally. You see a number that you don't like, and instead of, feeling bad, oh, I shouldn't have eaten that at lunch, drink some water. Drink some water, hydrate yourself, try to go on a walk, do some activity, check it again and see how your body reacts to those things. So, again, trying to empower all of you to know why you're checking your blood sugar and what to do with the number that you see. Okay, so for most glucometers, we have the ability to download a report. These reports allow us to see patterns. Patterns are trends in blood glucose levels. If the blood glucose level follows the same trend, say 2 out of 3 times, it's called a pattern. Do not expect to see the same levels, just the same kind of trend. So, focusing on the bigger picture, on the patterns, rather than every single reading, it can also help you to keep your emotions more level. And some people, don't like the number that they see. So kind of just knowing you're gathering data to kind of look at the big picture, and some examples of patterns that you might see is, okay, maybe my blood sugar is higher after dinner on most days. You can see to the picture on the right, there's 2 definite peaks happening there, probably at meal times. So talking about, what kind of foods are we having at those meal times? Can we adjust the carbohydrates? Can we go on a walk after that meal? Can we, move that meal earlier in the day so we're more active? So you might notice that whenever you eat at bedtime, your blood sugar kind of stays high all night and you wake up with a high blood sugar in the morning. You may notice that if you take a walk, 20-minute walk, your blood sugar goes down to a better level. You may notice your blood pressure is high when you're at work or maybe when you come to see the doctor, but it's lower in the evenings when you're at home. So monitoring, just to kind of get to know your body. So here you can see a more detailed picture of a report which breaks down the percentage of time spent in high range, target range, and low range. And you can see from the picture the times of days we talked about before, but from this information we can also kind of see daily glucose profiles along with the monthly profile. This tells you a glucose management indicator, which is kind of letting you know around what your A1C would be. And again, your hemoglobin A1C is a measure of an average blood sugar over the past 3 months. So it's a good indicator of how you're doing with your diabetes care. Okay, a lot of numbers here. It does look confusing, but talking with your doctor about this report or the dietitian or your diabetes care team to understand this report and again, use it as a tool to help you make some changes. So just talking about the importance of monitoring, regular blood sugar monitoring is the most important thing you can do to manage diabetes. Being able to see if you eat different foods, taking your medication or being more active, how does this work in your plan? And is it helping to keep your blood sugar and your target range to kind of prevent complications, such as heart attack, stroke, kidney disease? So your doctor will tell you when and how often to check your blood sugar levels. Okay, so ask questions. So you must know what your individual goals are, in order to meet them. So creating goals with your healthcare team, kind of sharing your data with the team as you're monitoring. So, how often should I check my blood sugar? What do the numbers mean that I see on my meter? Are there patterns that show I need to change my treatment? And again, what changes need to be made to the care plan? I like our little kind of thermometer image on the right. It shows you A1C value and kind of how it equates to a blood glucose number. So you can have an idea based on your, daily sugars of what your A1C is going to be. So as you monitor, you're going to gain insights into your self-care. So make sure that you share this data with your healthcare team. You don't have to share, all of your logs that you've done of activity or, all of your diet recalls, but maybe just like letting them know patterns you see or showing them, if that's how it's comfortable for you. So just kind of sharing the information that you've learned about yourself can help to see if your medication needs to be changed or other areas, that would benefit you. So talking about nutrition and physical activity are important parts of a healthy lifestyle when you have diabetes. So along with other benefits, following a healthy meal plan and being active can help you keep your blood glucose levels in your target range. To manage your blood glucose, you need to balance what you eat and drink with physical activity and medications if you take any. What you choose to eat, how much you eat, and when you eat are all important in keeping your blood glucose level in the range that your healthcare team recommends. You may worry that having diabetes means going without the foods that you enjoy. And the good news is that you can still eat your favorite foods. You may need to eat smaller portions, enjoy them less often, or change the time of day you eat them. Again, using a food journal can help to determine how your body reacts to different foods and meal times. So there's a lot of apps on our phones that we can use, My Food Diary. We can just write it down. You can put it on your notes in your phone, But I like to, if you are going to log your food that you're eating, it's important to be specific as you can. If you went to Starbucks, did you get a tall or a venti? So letting, how much did you eat? Did you eat a cup of pasta or was it, 2 cups? So that's really going to make a difference. And include any alcoholic beverages that you consume. Um, so myfitnesspal, or there's Lose It, all these different apps that can help you along the way. So monitoring your activity, being active makes your body more sensitive to insulin. Just helps control blood sugar levels and also lowers your risk of heart disease and nerve damage. So keep track of your physical activity. You can see the impact the activity has on your blood sugar. Again, at the bottom here, I like this, if you don't have time to do 30 minutes a day, it's okay to break it up. So 10 minutes here and there, so little things like if you're doing housework and kind of getting your heart rate up, that counts for your physical activity, 10 little increments 3 times a day. Take the dog on a walk, throw the ball around, dance in the kitchen, whatever works for you. Ideally, something that you enjoy doing. Okay, so monitoring your diabetes and reducing risks. And we know that the long-term complications of diabetes are related in part to damage caused by elevated blood glucose levels. And so because those elevated glucose levels can affect your whole body, regular monitoring can help to prevent complications. So again, heart health, checking your blood pressure, your weight, your cholesterol, kidney health, eye health, and foot health. So how does diabetes affect our cardiovascular system? Excess blood sugar decreases the elasticity of our blood vessels and it causes them to narrow, which limits the blood flow. Can lead to a reduced supply of blood and oxygen and increase the risk of high blood pressure and damage to large and small blood vessels. So regular blood pressure monitoring and making sure we're checking your lipids, which is your cholesterol, yearly. Your kidneys. So how does diabetes affect your kidneys? Again, over time, poorly controlled diabetes can cause damage to those blood vessel clusters in your kidney that filter waste from your blood. So this can lead to kidney damage and cause high blood pressure. High blood pressure can also just damage your kidneys by increasing the pressure and the delicate filtering systems of the kidneys. So getting a microalbumin urine test can check for small or micro amounts of albumin in your urine, just protein. And it can detect small amounts that regular urine tests might not be able to find. So small amounts of albumin in your urine can be a sign of kidney disease, and being caught early, is better for treatment. So just being on top of all of these things. And your eyes, right? So having your eyes checked yearly. Again, those tiny blood vessels in your eyes can get damaged. And so this is the leading cause of blindness in working age adults is diabetic retinopathy, is what it is called. We have a really great machine here at the clinic that can take a picture. It takes about 5 minutes. Very easy. So your feet are very important. Different reasons. If we have excess weight or mobility issues, it may be hard for us to even look at our own feet. But it's very important to kind of pay attention. If we have poorly fitting footwear or socks that are bunching up, if we have a little bit of neuropathy where we can't feel what's happening at the bottom of our feet, there could be a sore or an injury that happens there that we don't know about unless we see it with our eyes. And so, using mirrors, in the clinic, or my favorite thing is, when you go to the doctor, take off your shoes and socks and let them look at your feet to make sure that there is no little problems that could turn into a bigger problem that you wouldn't be aware of. So setting goals is important. And, not just any goals. I could set a goal and say, in 1 month I'm going to run a marathon. And it's not going to be a very realistic goal. And I'm probably not going to achieve that goal. I'm probably going to feel bad about myself. So talking about SMART goals today, how to set goals that are smart, right? So specific, be clear on what you want to accomplish, okay? Make sure it's something measurable, something, something that's quantifiable, something that's achievable. Maybe it's not too easy and it's not too hard, something, realistic. Relevant, it must be relevant to what you're trying to accomplish. Okay. Time bound, so setting a clear time frame and deadline to achieve your goal can kind of help. That goal could just drag on for a year if you didn't have really any set time bound limits. So I have this little worksheet here, and I just put a goal. My goal is to walk at least 40,000 steps each week for the next 3 months starting today. I track my steps on my phone. My iPhone has a health app that I can go on there. It just tells me how much I move around. And so I can average, 8,000 steps a day. And there's 7 days in the week. So I figured that this was a pretty, obtainable goal. It's realistic. It has a time on it. But again, here's this worksheet, if you wanted to make some goals and kind of fill out the worksheet to help you along the way. Using your log, your food logs, your activity logs, all of these things can help you to make sure that you're reaching your goals. Okay, so again, thank you so much for joining this class on the 7 self-care behavior goals. Please feel free to contact us in Healthy Traditions. You know, if you want to make an appointment to talk to the dietitian, if you're looking for some healthy recipes, or if you just have a question. Again, thank you and have a great rest of your day.